Hello students, a very good afternoon. I'm very sorry for the delay. That was because of the technical issues. All right, so before we start the session, I'm going to launch a poll on technical check. Please let me know if the audio on the board is visible. Please let me know if my audio as well as the board is clear. All right, so I will end the poll now. So if there is any technical issues with respect to my voice or the screen that is displayed, please let me know. Okay. Fine. So today we have to start with another endocrine gland, that is the thyroid gland. So you would have heard about the terms called as hypothyroidism and hyperthyroidism, right? So, and you would have come across people having the symptoms of goiter also. So when we talk about the thyroid gland, the anatomically it is one of the largest endocrine gland that we have. Okay. So the thyroid gland have, yeah, 1 second. Yeah. So when it comes to thyroid gland, it is located on the either side of the trachea. So you can see your windpipe. It is present on the either side of the windpipe. Okay. So the both the lobes, you have your left lobe of your thyroid gland and you have the right lobe of your thyroid gland are connected by a connective tissue, and this connective tissue is called as the isthmus region. Okay, or the isthmus. So thyroid gland is basically composed of follicles as well as stromal cells. So follicles are certain bodies that you can find in the organs like thymus. Okay, you can see that they are spherical mass of cells, so they'll be made of follicular cells. And these follicular cells, in the central part there is a cavity. Cavity means there's a space. Okay, so this space is used for collecting the secretions that these follicular cells produce. Okay, so when we talk about the follicular cells, they participate in secretion of three types of hormones basically. One is thyroxine. So it is also called as tetroiodothyronine or T4. Okay. Tetra is T4 and other one is tri. Okay. Triiodothyronine, that is T3. All right, people. So on the other one is called as thyrocalcitonin. It is also called as TCT. So follicular cells, follicles, they have cells. These cells are called as follicular cells. And these follicular cells, they form a cavity in the center. So they secrete the following hormones like T3, T4, as well as TCT, which will be collected in these central cavities of follicles. Okay. So 1 second, people. Where did it go? Yeah. So when it comes to the functions of your T3 and T4, okay, that is thyroxine as well as triiodothyronine. So their production is basically dependent upon the iodine in our diet. Okay. So if there is any problem, okay, so it would affect the following regions. So if you let us know the functions of these T3 and T4. So T3 and T4, they have influence in controlling basal metabolic rate, that is also called as BMR. Okay. And it is also responsible for physical, mental, and sexual development of an individual. Okay. Throughout our lifetime. Now, coming to, when we talk about T3 and T4, and they have this role in, for example, supporting the RBC formation as well as controlling metabolism of carbohydrates, fats, and proteins. And they also maintain a water and electrolyte balance. Okay. So next one, when we talk about the other hormone called as thyrocalcitonin, that is TCT, this is the hormone that is responsible for lowering the blood calcium level. Okay. So what happens is, for all these hormones, that is T3, T4, as well as thyronin, okay, thyrocalcitonin, all of this require a sufficient amount of iodine in our diet. So whenever there is deficiency of iodine in our diet, it leads to a condition called as goiter. So goiter is a condition where, because of the deficiency of iodine, the the thyroid glands will start swelling up. Okay, because of this, there is less production of your thyroid hormones. So once it becomes enlarged, so based on the age, for example, if there is hypothyroidism seen in adult women, so for them, what happens is there is irregular menstrual cycle that happens with them. So okay, so especially there is one specific time where you don't want the deficiency of iodine as well as having this goiter, that is during the pregnancy. So during pregnancy, what may happen is, so it might cause effect on the fetus. For example, the baby will start showing stunted growth, okay, or mental retardation, low intelligent quotient, abnormal skin, okay, deaf mutism. So all these abnormalities a baby can develop if the woman is having this hypothyroidism during her pregnancy. Okay, so another, few more symptoms of your hypothyroidism is, for example, uh, there are cases where your thyroid becomes very high. Okay, actually, this is hyperthyroidism, not hypothyroidism. The above slide. Okay, 1 second. Give me, yeah. So when we come to hypothyroidism, this is actually hyperthyroidism. Yeah, this is called as hyperthyroidism. Okay, 1 second. Sorry, students. I think there is a mistake. There is a problem with the stencil. Okay, so I'll just use the slide. Okay, so when it comes to hyperthyroidism, what is hyperthyroidism? Basically, these thyroid hormones are produced in larger volumes. Okay, so when they're produced in larger volumes, now what happens? There are chances of abnormalities in the physiological activities. Okay, so whenever an individual, in an adult, the reason for this hyperthyroidism is, if the thyroid, see in the left picture, you can see that there are nodules, okay, or it might also lead to cancer nodules or thyroid cancer. Okay, so at this point, there is a lot of production of thyroxine, or thyroid hormone. So that leads to hyperthyroidism. It is also called as exophthalmic goiter, or it is also called as Graves disease. Okay, so in these cases, what happens is, so this enlargement of this thyroid will lead to the symptoms like, the person will have protruded eyes. You can see their eyes in the given the picture. Okay, they will have protruded eyes, increased basal metabolic rate, as well as weight loss. So this is the case with hyperthyroidism. Okay, so when the next gland that we have to talk about is the parathyroid gland. So parathyroid glands are integrated in the lobes of your thyroid glands. So if you see in the left picture, there are two lobes, right? Left lobe and the right lobe for the thyroid gland. You can see that in the left lobe, there are two parathyroid glands. In the right lobe, there are two parathyroid glands. Okay, in total, four, two in each lobe. Okay, so the role of this parathyroid hormone is they secrete PTH. It is also okay, and it is a peptide hormone. So the functions of parathyroid hormone is basically it regulates the blood calcium levels, okay, or it increases the blood calcium level. So how does it do? The one of the major banks of calcium that is present in our body is at the bones, okay. So it goes and acts on the bone cells for their demineralization. That means the bone cells will start breaking, and then it releases the calcium that is present in the bones, okay, into the blood. And it also affects on your renal system, okay, that is renal tubules, where the calcium loss is prevented. Okay, more calcium is reabsorbed back into the blood. And it also affects our intestines, where more absorption of calcium takes place in our digestive tract. Okay, so along with the TCT that we talked about, even the calcium balance is provided by this parathyroid hormone. Okay, so next one is thymus gland. Okay, so you might have heard about the thymus gland, right? So thymus is usually very large in babies, and as we grow up, it becomes smaller and smaller. So that is one specialty about thymus gland. So when we see the location of the thymus gland, it is very easy to remember because we have the breastbone, that is the sternum, just below the sternum and above the heart. Okay, on the ventral side of the aorta is your thymus gland. So thymus gland has a very crucial role in our immune system basically. So they secrete a hormone called as thymosins, which is a peptide hormone. Okay. So you might have heard about lymphocytes. You remember? Okay. Lymphocytes are of two types. One is T lymphocytes, other one is B lymphocytes, which are the part of your immune cells. So the T lymphocytes, the letter T in the T lymphocyte is derived because of the thymus. So why it is derived because of the thymus? If you see the role of T lymphocytes, they have a tremendous role in our body. For example, these are able to recognize which is our own cells and which is not our own cells. They're also defending our body by, starting up cell-mediated immunity. Okay, and there are so many functions of T lymphocytes when it comes to protection of our body. Okay, so what happens is when the lymphocytes are born, the T lymphocytes are born, they migrate to the thymus for maturation. Okay. So that maturation process is influenced by the hormone thymosin. Okay. Now, next one. The thymosin hormone not only influences the T lymphocytes, the other type of lymphocyte is the B lymphocyte. So it influences the B lymphocyte cells to produce specialized proteins called as antibodies. Okay. So these antibodies are also having an important role in immune system called as humoral immunity, whereas T lymphocytes have the role in cell-mediated immunity. Okay, so this is about thymus gland. Okay, so especially if you observe in the older individual, I told you like the thymus, actually becomes smaller and smaller and smaller as we grow up. You can see in here in the left slide how big is in the newborn, and as we grow up, like 10 years old, 25 years old, 50 years old, and 70 years old. So the thymus is degraded, progressively as we grow up. Okay, so that will lead to what thymosin degeneration will happen, or a decrease in thymosin production will happen. So that is why the older people will not be able to defend themselves, or they don't have stronger immunity, or they're immunologically weak. Okay, so the next organ we have to study is the adrenal gland. See, adrenal gland is located on the anterior part of your kidneys, and it is a conical structure. So adrenal gland can, when you take the cross section of adrenal gland, here you can see in this picture. So I'll try to use a stencil if it works. Yeah, yeah. So if you see the cross section of the adrenal gland, you can differentiate it into two anatomical regions. So the outer region and the inner region. So the outer region is called as the cortex region. Okay, this is called as the cortex region, and the inner region is called as the medulla region. Okay, so I might have heard about adrenal gland. Okay, so let's start with the adrenal cortex. Okay. So adrenal cortex produces several important hormones. Okay. So these are called as corticoids. So these corticoids have specific role. For example, there are glucocorticoids, mineral corticoids, okay, etc. So let's take one of the corticoids, that is mineral corticoids. So what is the function of mineral corticoids? So they act on your body, okay, and they regulate the water levels in the body, that is reabsorption of water, electrolyte balance, osmotic pressure, as well as the blood pressure is maintained because of mineral corticoids. And there are another another type of corticoids called as aldosterone. Okay, so they stimulate the reabsorption of sodium and water from the renal tubule. Okay, and they also excrete the sodium and phosphate ions. See, all these functions, since they have an effect on sodium, potassium, as well as phosphate ions, so they are basically more involved in electrolyte balance. Okay, fine. So when we talk about adrenal, okay, adrenal be divided into three important zones. The first one is inner zona. See, you can see here. So from inside we have to talk. Okay, the inner zone is the zona reticularis. Okay, and the medial zone is called as zona fasciculata, and the upper zone is called as zona. Okay, oh sorry, zona glomerulosa. Okay, so you can see that there are three layers, right? Fine. So these three layers, they produce different types of corticoids, as I told. One is glucocorticoids, other one is mineralocorticoids, and next one is androgenic corticoids. So coming to glucocorticoids, okay. So glucocorticoids, they influence the carbohydrate metabolism, okay. So when the carbohydrates are broken down, usually what happens, the glucose levels in our blood increases. So some of the types of glucose, gaining the glucose is, one is gluconeogenesis, that is from your carbohydrates to your glucose, lipolysis, as well as proteolysis, right? And they also inhibit, they will not allow the cells to uptake or utilize more amino acids from your blood. So they are also involved in cardiovascular system as well as kidney functions, okay? And cortisols are known to stimulate the red blood cell production, and they cause anti-inflammatory effects by suppressing the immune system. So usually during the injury case or whenever there is tissue damage or anything, so what happens, we are given these, okay, that is anti-inflammatory drugs for preventing the swelling, right? So one category of them is this cortisols, okay, which are having the anti-inflammatory properties. Fine. So and the last one is androgenic corticoids. What are androgenic corticoids? So these are the corticoids which are responsible for some of the developments, like morphological developments, like axial hair, pubic hair, facial hair during puberty. Okay. So this is about androgenic corticoids. So what would happen if there is deficiency of these corticoids? Now we have understood the role of them. Okay. For example, while increasing the, carbohydrate metabolism, okay, uh, breakdown of lipids, as well as when you talk about so many different functions that they're involved in, what would happen if there is a deficiency of these corticoids? So if there is a deficiency of these corticoids, so a person will start expressing acute weakness, okay, and tiredness, that is fatigue. So this condition is also called as Addison's disease, okay. So deficiency of corticoids causes Addison's disease. So next one is adrenal medulla. So you might have come across situations where you experience, when you see something that you are very afraid of, or when you are about to start a race, for example, okay. So you might have felt your heart rate, no? So when you're very anxious, for example, if you want to give a speech before everybody, correct? So you feel the sense of fear and your heart races and you start sweating and you are very excited, somewhat, it's like a fight or flight mechanism. So that kind of expressions is basically coming because of the secretions of adrenal medulla, right? So for example, adrenal medulla, they produce a class of hormones called as, okay, catecholamine. Catecholamine, uh, such as adrenaline and noradrenaline. So adrenaline is also called as epinephrine. Noradrenaline is also called as norepinephrine. Okay. So when these hormones are secreted, it creates a tremendous amount of boost in the emergency situations. So that time, your body starts showing certain alteredness. For example, your pupil will become larger and dilated. Okay. So when you look at a person's eye, if the black spot in the eye is enlarged, okay, that means there is an adrenaline rush. Okay. That is piloerection, rising of hairs. Okay. When you watch horror movies or when you're afraid or cold. Next one is sweating, heartbeat, heart contraction, as well as the respiratory rate. They're all controlled by this adrenaline and noradrenaline. Okay. So because of their excess boost, they also stimulate the breakdown of glycogen for the immediate, you will have an energy boom when you have this adrenaline rush. Okay. So that is because the glycogen breakdown will happen in a very faster rate, releasing more and more glucose into the blood. Okay. So it also influences other types of, okay, energy sources like lipids and proteins, where it helps in breaking down of these, increasing the energy. Okay. Fine. So the next organ is the pancreas. So pancreas is a very important organ and it is very popular among, in all of us, because in most of the cases we see in our society, people suffer from this disorder called as diabetes mellitus. Okay. So through that, we know, we are very familiar with pancreas. Lying just below the stomach, right? Pancreas is a very unique organ because it has both exoendocrine function, we can tell. right? So exoendocrine function, that means it can behave as both exocrine gland as well as endocrine gland. Okay. So that is what this type of a gland is called as heterocrine gland. All right. So if you see the endocrine part of the pancreas, what you find is there are very special type of cells called as islets of Langerhans cells. Okay. So these islets of Langerhans cells, they are about 1 to 2 million cells in the entire pancreatic tissue. So if you see how much is 1 to 2 million cells, it is only 2% of the pancreatic tissue. Okay, out of 100%, only 2% is your islets of Langerhans. So if you see islets of Langerhans, they possess two important types of cells. One type of cell is called as B cells, and the other one cell beta cells and alpha cells. Okay, so if you see the beta cells, it's not the B cells, it is beta cells. The beta cells of islets of Langerhans, so they're responsible for secretion of a hormone called as glucagon. Okay, whereas the alpha cells are responsible for insulin. Fine. So sorry, alpha cells is for glucagon, beta cells is for insulin, okay, respectively. So they maintain this glucose homeostasis. So what happens? They're opposite hormones when you see glucagon as well as when you compare it with insulin. So glucagon, they act on liver cells, that is hepatocytes, and they help in stimulation or starting of glucogenolysis. So when the glucogenolysis is happening, okay, so there is increase in blood sugar. Okay, other one is so whenever there is increase in blood sugar, this condition is called as hyperglycemia. Okay. So what happens? What is hyperglycemia? Hyperglycemia is increase in glucose levels in our blood, and that is possible because of stimulation of glucogenolysis as well as gluconeogenesis. Okay, so when the carbohydrates are broken down to glucose, or when glycogen is broken down to glucose, so what happens? There is increase in glucose level in our blood, as well as it also affects on our tissues which require glucose. So it stops the tissues from absorbing the glucose from our blood. Okay, so that is why we have higher blood glucose level. Okay, so what is a function? So when you talk about hyperglycemia, it is one way it is helpful because you require when you want to like conserve more of the energy, or when you have to transfer more energy into your tissues, so that is very important. Whereas whenever these hormones act on like hepatocytes or adipocytes, so their glucose, that is cellular glucose uptake, will be very high. Okay, so the increase in this blood glucose level actually decreases with the influence of insulin. Okay, so insulin basically acts on this hepatocytes and adipocytes again, and it will ask them to utilize more and more glucose from the outside. So this utilization from the adipocytes and hepatocytes decreases the blood glucose, okay, in our body. So this decrease in the blood glucose level in our body is because of insulin. Okay, so insulin actually decreases the blood glucose level, whereas your glucagon increases the blood glucose level. So whenever we have an individual who have a very high levels of blood glucose level all the time, that is hyperglycemia condition. So that leads to a rare disorder called as diabetes mellitus. So the individual suffering from diabetes mellitus show symptoms, okay, such as they excrete glucose through urine, okay, and their body shows the formation of ketone bodies. So they will have excess urination as well as thirst. Okay, and we use insulin as a successful treatment for treating diabetes mellitus. So you might have seen our people who use insulin in the form of syringe or or through the pills, right? Insulin pills. So I think this is about it. Thank you, students. We'll summarize it better in the coming session. So if you have any doubts, you can use the chat box. Okay, students. So we will continue in the next class and we will summarize also. Thank you very much. I will end the session now.